Okay, here we go again. Welcome back to HelpMeWithMyTeeth.com. I'm your host, Dr. Martin Potter. Today we're going to try to have another run at another juicy pandemic topic. Today we're going to take on the so-called mask mouth. Well, probably many of you heard about the dreaded meth mouth. This is a dental condition that is a whole syndrome of oral complications that are sort of revolving around the use of crystal meth. And there's sort of direct and indirect effects on it, but that's not our topic today. Today we're going to get into something called mask mouth. Yeah, I know it sounds like a joke, but it really isn't. This is actually becoming an increasing problem as we're finding millions, if not billions of people now are wearing masks on a regular basis, and we're noticing an oral condition or a periodontal condition that is kind of coming upon us that may be connected to the prolonged use of masks. So here we're talking about dentists say mask mouth can cause serious health complications, including strokes. That's a pretty serious charge. Let's get into this a little bit more here. Dentists are warning about the health issues tied to prolonged use of a mask to stop the spread of coronavirus. They said dental problems associated with mask mouth, including gum disease, could lead to serious complications. Okay, gum disease, periodontal disease. Let's talk about that a little bit. For those of you out there who are blessed with nice, healthy connecting tissues that connect your teeth to your gums and bone, you won't really understand this too much. But for those of you out there who have struggled with periodontal disease or gum disease, you know really how awful of a condition this is. Mostly because it's really hard to get rid of it. Once it gets going, you're kind of stuck with it. You just sort of got to nurse it along and just kind of live with it. I always like to talk about it like rust with your car. Once the rust starts, it's really hard to turn it around and get rid of the rust. You just sort of have to live with it, try to slow it down, and sort of stay on top of it. Gum disease is a lot like this. Gum disease or periodontal disease will eventually lead to strokes and an increased risk of heart attacks. Well, the research in the last 10 years has made a much more serious connection between gum disease and cardiovascular disease and cardiac problems. Seems like a stretch. How could something in your mouth actually be connected to something with your heart? Well, this is all about the bugs. This is all about the bacteriology, the microbiology of what's going on. Cavities and gum disease, and generally oral disease, is caused or certainly associated with changes in your microflora, the bacteria that normally reside in your mouth. I know it's a gross topic, but we have tens of thousands of microbiological species, bacteria mostly, but also viruses and yeast and those sorts of things that live in our mouth. So most of them are commensal organisms. These are happy bugs, good bugs, bugs that are connected to the health of our entire gastric system and are part of the digestive process. So don't think all bacteria are bad guys. But gum disease is definitely associated with an increased risk, an increased proliferation of anaerobic bacteria, anaerobic, as opposed to aerobic. There's generally two big classes of bacteria, anaerobic and aerobic. Aerobic bacteria generally are the friendlier ones. They're the ones that are happy with air. Anaerobic bugs don't like air, so they find places in your mouth where there's no air, which is often in your tongue and underneath your gums, which is why we recommend that you brush your tongue regularly, because it will reduce the spread of anaerobic bacteria. So when these bacteria are living in your mouth at higher levels, they can enter your bloodstream and work through your entire systemic cardiovascular system, and there is some evidence that they can actually lodge on your cardiac tissue and cause problems there. So this same kind of concept is what's working here with this mask mouth. Another dentist and co-founder at One Manhattan Dental, Rob Raimondi, said 50% of his patients are suffering from negative health issues due to wearing masks. Wow, that's pretty striking. We're seeing an inflammation in people's gums that have been healthy forever and cavities in people who have never had them before, Raimondi said. About 50% of our patients are being impacted by this So we decided to name it mask mouth, stemming from meth mouth. Meth mouth, we already talked about that. The dentist said that the face coverings increase mouth dryness and contribute to a buildup of bad bacteria. That's back to those anaerobic bacteria we were talking about. This is nothing new in dentistry. We see this a lot with people who are chronic mouth breathers. People who have malocclusions, you know, a funny kind of bite, especially if they have an open bite where their front teeth aren't touching together. And if they have nasal obstruction, a lot of people chronically mouth breathe, and especially at night, they get into snoring, sleep apnea. But we notice a chronic inflammation of the gum tissue in those types of people also. So we're finding out that people that wear masks are mouth breathing a lot more, and so this is likely contributing to a change of the flora or the bacterial counts in your mouth, the types of bacteria that are living in there, and then getting this whole mask mouth going. People tend to breathe through their mouth instead of their nose while wearing a mask. Sclafani said the mouth breathing is causing the dry mouth, which leads to a decrease in saliva, and saliva is what fights the bacteria and cleanses your teeth. Yes, we definitely find this in mouth breathing because there's just more evaporation also, and the saliva tends to evaporate away and it dries out your mouth, and you combine that at night with the reduced salivary flow at night and problems begin. That's why a lot of these people that chronically mouth breathe have a lot more trouble with jungle mouth, aka bad breath. Sclafani suggested that those who have no choice but to wear masks can drink more water, cut down on caffeine, snag a humidifier to moisten the air, use an alcohol-free mouthwash, scrape their tongue. See, we were talking about that already. The tongue is a big place for anaerobes to go hiding. If your tongue's got kind of little wee villi in it, the bacteria tend to go hiding in there. Pick up a tongue cleaner next time you're at the drugstore. They're cheap, give it a try, see what you think. And refrain from smoking. Wearing face coverings to stem the spread of coronavirus has become a contentious issue across the United States, with some states and cities imposing mandatory face mask requirements, while others have filed lawsuits to defy those precautions. Yeah, well, we're not here to really get into the political side of this. We're interested more in the dental side of it. But this is probably something that isn't going away anytime soon, so definitely want you to just be watching your gum tissue. If you're seeing any increase in bleeding, inflammation, a change in the taste or in your bad breath, definitely visit your healthcare provider and get that checked out. Supporters of mask requirements, including the Centers for Disease Control and Prevention, argue that cloth masks are effective in stopping the spread of the virus, while critics cite studies showing a lack of evidence of effectiveness. Again, that's not really the point of our discussion here today. We just want to keep your gums going well. We don't want you getting into periodontal disease and having future trouble with your gum tissue going the wrong way. Okay, so hope that helps bring a little clarification to the whole mask mouth syndrome. Well, that was short, but I don't know how sweet that was. Thanks for joining us again here at HelpMeWithMyTeeth.com. Be sure to like and subscribe below. Feel free to leave a comment, and we'll catch you next time. You have a great day now.